use your critical thinking. So consider the events. What is it that might go wrong? And be creative. Think out of the box, because sometimes, it is important that you also take into account things that are not the norm and, that are special to your study, and therefore consider those events, since these things may go wrong. What are the possible consequences? Is it a minor consequence, or is it a major one? Is it one that eventually could harm your entire study, could harm patient safety? And those consequences need to be taken into account. Could it lead to significant impact to data integrity or to trial participant safety and rights? So in the latter case, if the informed consent form process is not being adhered to, it could have a detrimental impact on or consequence on the safety of the patients and the rights of the patients. So those always need to be kept in mind. What is the possible extent? Might it affect one participant or multiple, one site or multiple, a country or the whole study? And of course, if it is only affecting one participant, depending on the type of study, then the data integrity, for instance, as an example, might not have such an impact. But I recall oncology studies where sometimes the correct assessment of the MRT, for instance, of one participant could make or break a study, depending on what the statisticians ask for and what the respective requirements are to make a study or break a study. I have seen also cases where a country, an entire country, contributed to a study, and the patients that they provided to the study were not fitting to the rest of the study, and in particular not to the protocol. And when things like that are being detected late in the process, it could really have a really negative impact on the study.